This podcast has been created with the intention of informing about significant findings on sleep development in early childhood. Early years teachers and assistants could find it especially useful. However, the information discussed here can be of benefit to anyone looking after children between the ages of 6 months to 5 years old. We will explore the development of regulated and consolidated sleep-wake patterns as one of the most prominent developmental processes of early childhood. First, we will explain the importance of helping children with their sleep consolidation from the early stages. Also, since data highlights that the use of different settling strategies significantly influences sleep development, we will explore them and their effects. Moreover, we will go through the use of settling strategies throughout time, to then conclude with some helpful highlights from the literature. The importance of helping children sleep is highlighted by existing work, which has found that the early identification of childhood sleep variations is associated with improved cognitive, behavioral, and socio-emotional outcomes and family functioning. Developing the behavioral aspects of child sleep, such as sleep schedule, self-soothing ability, night wakings, and sleeping arrangements, has an important role. Therefore, the use of different settling strategies can significantly influence a child's sleep development. So, what is a settling strategy? Sleep-related settling strategies refer to the behaviors adopted by caregivers to settle the child to sleep. We should not confuse them with aspects of the general bedtime routine. They have been abundantly explored by research, and they are believed to strongly influence the child's sleep and, in turn, the parent's sleep. There are many types of settling strategy used by caregivers. Some of them involve physical comforting. These represent strategies in which the caregiver believes that they must be present and actively settle their child to sleep, such as cuddling and rocking, stroking or patting the child, talking softly or reading a story, singing a lullaby, playing with the child, settling the child on the sofa, carrying the child around the house, settling the child in the parent's bed, also known as co-sleeping, lying next to the cot, giving a drink, or breastfeeding. Other strategies encourage autonomy. These strategies expect that the child will settle by themselves, such as playing a musical tape, offering a special toy or cloth, and leaving the child to cry. And some strategies involve movement, such as taking the child for a walk in their pram and taking the child on a car ride. The strategies used by caregivers are not mutually exclusive. However, throughout development, it is expected that caregivers would adapt and change their strategy use as the infant gains autonomy. However, this is not always the case, and evidence suggests that this might be the point where sleep variation arises. So let's talk about child sleep variations. Although around the age of 6 months, most infants achieve the ability to sleep through the night, variations in settling to sleep and night wakings characterize about 20 to 30% of all infants and young children, to the point that these variations are among the most prevalent parental concerns. Child autonomy is highlighted as the goal in children with sleep differences, as consolidated sleep links to the child's ability to fall asleep by themselves and get back to sleep without asking for the caregiver's support. Previous research shows that infants with less opportunities to develop autonomy when settling to sleep tend to become reliant on the caregiver's help upon awakening, as they are less likely to have opportunities to learn to self-settle and develop self-soothing capacities that are necessary for consolidated sleep. Moreover, evidence suggests that delayed adoption of encouraging autonomy strategies is associated with a greater likelihood of persistent differences on the development of infant sleep-wake regulation. It is suggested that decisions around setting limits on the infant, efforts to understand the infant's needs, and self-image about parenting ability can play an important role in choosing when to reduce the use of active physical comforting and increase the use of those strategies that encourage autonomy. The critical factor in facilitating infant sleep-wake regulation appears to be in the balance between the use of physical comforting versus encouraging autonomy strategies. For instance, previous studies have shown that parents of infants with consolidated sleep still use active physical comforting as one of their most frequently used strategies, but this seems to be balanced by an equivalent use of the encouraging autonomy strategies. In contrast, parents of infants with non-regulated sleep show a marked difference in this pattern, demonstrating excessive use of physical comfort and less autonomy encouragement. Therefore, data suggests that the balance between these two strategies seems to be of most importance. Findings demonstrate significant developmental changes in sleep during early childhood. Therefore, an adjustment to settling strategies is expected throughout this period. Data suggests that, from 3 to 6 months old, physical comforting strategies tend to be used to a large extent, as parents are dealing with very young infants. During this stage, infant nocturnal sleep becomes more consolidated. This is reflected by a lower number of night wakings, shorter wakefulness during the night, and more extended continuous sleep periods. Daytime sleep also shows a reduction during this postpartum period. From 6 months old, the settling strategies evolve as the child grows up. During this time, different kinds of strategies are used simultaneously by parents. The frequency of limit-setting strategies increases and overprotective behaviors decrease, bringing a reduction of immediate responses and an increase in behaviors that encourage autonomy. When this change in settling strategies is not applied or is delayed, children might become more likely to experience frequent night wakings. Studies mainly conducted on preschool-aged children suggest that when using consistent bedtime routines as part of the settling strategy, children experience a shorter transition from wakefulness to sleep, reduced night wakings and less bedtime resistance, and longer nighttime sleep duration. In summary, sleep undergoes significant development during the first 2 years of life. Early variation in infant sleep reflects the normal individual differences between infants and is to be expected. However, by around 5 years, sleep variations are less usual and may indicate an issue. Some settling strategies are considered as adaptive and more likely to promote sleep consolidation. For instance, all those strategies that encourage the child's self-regulation, usually guided by a limit-setting approach and stable and consistent bedtime routines. On the other hand, settling strategies that do not promote autonomy seem to affect sleep consolidation, for instance, staying with the child until they fall asleep every time. One of the sources of variation in sleep is how sensitive the child is to sensory stimulation. Parents and caregivers can pick up on this sensitivity and try to minimize sensory stimulation during sleep, for instance by dimming lights and sounds and checking whether the child is not too hot or too cold and whether the bedding is soft enough.